Thanks very much, Will. Good morning, everyone. Throughout this pandemic, Doug Ford has always been 2 steps behind, 2 weeks behind. The third wave is here, and yet he's been relaxing public health measures. He's banked on the vaccine rollout to slow the third wave, yet there are hundreds of thousands of doses in freezers, with more than 1 million coming this week. Simply has not been able to get vaccines into the right arms or to the right places fast enough. Family docs, they're still asking the government to work with them more than a month later. It's absolutely incredible. Doug Ford needs to stop blaming others for a problem that's of his own making. And right now, it's evident there's no plan B. Over to you, Jill.
Great. Thanks so much, John. Thanks everyone for being here today. The biggest problem that we've had so far with this vaccine distribution is the inequity in the plan. So we know that throughout this pandemic, there have been regions that have been harder hit than others. For example, here in Peel and in areas like Thunder Bay, we have been seeing just record numbers, and consistently throughout this past year, Peel has had the highest numbers throughout the pandemic. Unfortunately, we're not seeing vaccine distribution that matches what we're dealing with in these regions. And until we see vaccine distribution that matches what we're facing, we will continue to see those high case rates growing and rising. And nothing is going to get better until we deal with the problems where they are biggest. Peel has been on fire, and Doug Ford has abandoned our region and regions like Thunder Bay, like Lambton. We have in our region approximately 300,000 essential workers in large-scale facilities who are unable to physically distance at work. They earn a lower income, and they don't have access to paid sick days. So we have people who have kept Ontario going throughout this pandemic. They have kept our shelves stocked, our orders fulfilled, but they have been, unfortunately, at the center of these outbreaks. And until we make sure that we are prioritizing these workers, we will continue to see our numbers grow. So we are in great need here and throughout this province of making sure that we're meeting this pandemic where it is burning the hottest, or we will never get control of it.
Well, thanks very much, John, and thanks very much, Jill, both for being on the call this morning, but also for the great work, John, that you're doing as our critic for health and long-term care, and Jill, with your expertise and the work that you're doing as our candidate in Mississauga-Streetsville. You heard it loudly and clearly from both John and Jill. And frankly, Ontarians have kind of seen this sad movie before. We know that last summer, when the case numbers started to drop the first time a little bit, that Doug Ford went out on a premature victory lap, touring the province instead of being where he needed to be, which was at the table with public health leaders, with scientists, to get ready for a second wave. So he wasn't ready for the second wave. We've seen that he's not being ready for the third wave. And we all witnessed the very sorry spectacle of the very political press conference that Doug Ford did last Friday in Brampton, when it was abundantly clear that he has already made the decision to start campaigning for re-election and abandon the people of Peel, of Toronto, of York, and of Ontario, who are waiting so desperately for vaccines. As John said a second ago, there are about 500,000 vaccines that are sitting, languishing in Doug Ford's freezers, instead of being in people in this province. So what we're calling on Doug Ford today to do is to stop the campaigning, which is horribly premature, to come back to the science table, to get the very best advice possible, and to put forward a coherent plan that the people of this province can truly understand, that prioritizes essential and vulnerable workers in our hardest hit regions, that people, again, can digest and understand wherever they live in this province. We need real supports for the small businesses that have been battered so badly, not the weak measures that were produced in last week's budget. And if Doug Ford would fully understand what his job is, what the people of Ontario need him to do in this critical moment, he would realize it's important for him to stop the premature campaigning, get to the science table, talk to the very best leaders that we have, get those vaccines out of Ford's freezers and into people's arms so Ontario could get to the other side of this pandemic successfully. Happy to take your questions.
Okay, and a reminder for all on the line, if you just please raise your hand using the Zoom function, I will call on you. Okay, first question is Colin DeMello from CTV Toronto.
Hey, good morning, Stephen. I'm just curious about exactly what you're hoping is going to happen over the next few weeks. Do you feel like, a third wave lockdown is necessary or shutdown is necessary? Because it seems like the province is focused on kind of rolling back a lot of the gray zone restrictions to open up more portions of the economy. What do you think should be happening over the next few weeks?
So I think the biggest challenge we have is that there's no clear direction about what's happening. Some zones, we see the restrictions being loosened. Other places, they're getting tightened again. It feels to me, this is very much like a very bad sequel to where we were last summer, except the difference is that Doug Ford's out campaigning when the numbers were going in the wrong direction. So last summer, he was out campaigning when the numbers were coming down. But today, as I said, last Friday in Brampton, today, I believe he's in Niagara region. He's out there on another premature political kind of victory lap. Numbers are going in the wrong direction. ICUs in certain parts of the province are being overwhelmed. Frontline docs need help. They need support. So I do have grave concerns about the restrictions being loosened. And I say that recognizing that thousands of Ontarians want to feel some degree of normal again. And of course, so many thousands of businesses, particularly in the restaurant sector, they're looking for a lifeline. So I understand all of that. But the numbers are going in the wrong direction in places like Peel and York and Toronto, as they have throughout this pandemic. So we need Doug Ford to know what his job is. Stop the politics, stop the campaigning, get the vaccines out of the Ford freezers and get them into people's arms. And the only way to do that is to actually have a real plan. And while you're developing that real plan and it's ready to go and it's coherent and understandable, listen to the best advice that's coming in relating to whether restrictions should truly be lifted or not, or whether or not we need to consider targeted lockdowns to get through this third wave.
Follow up.
Thank you. And on vaccines, we're seeing mass vaccination clinics with many more appointments than people who actually seem to want the vaccines. Whatever the reason is for why they're not showing up, I'm wondering if the province should allow these regions to create a standby list. And who do you think should be on that standby list? Should it be priority groups or should it be anyone? Because there seems to be quite a high demand outside of those priority groups who want a vaccine right now. Should they be on a standby list to be called at some point if those vaccine appointments are available?
So I have no problem whatsoever with a standby list. I think it's always important to have a contingency. We want to make sure that the vaccines get deployed as quickly as they can. You heard Jill talk earlier, and I was in Peel a couple of weeks ago, and again last Friday, just using Peel as the example, 300,000 plus essential workers, women and men who've gone through hell over the last year, trying to keep food on their table and support their families while they've had to go to work. Looking at essential workers that we have in places like Peel, Toronto, York, Ottawa, and elsewhere, I think would be really important to consider. John also mentioned in his comments, I don't really understand exactly where family docs are in the entire sort of system that we have. I know that literally for months before he got his first vaccine, my dad kept asking me if he was going to be able to go and get his shot from his family doctor, the individual that he's got the closest relationship with in the medical system. So again, not enough clarity around the role that family docs can help to play as it relates to getting vaccines out. But Colin, these are the exact kind of questions and answers that Doug Ford and his team, working with the science table and healthcare leaders, should have been planning for in November, December, January. We're only a few days away from April. Again, numbers going in the wrong direction. ICU is starting to be overwhelmed, patient transfers occurring. And where's Doug Ford? He's out there talking about politics. He's out there talking about his re-election campaign. He has the wrong priorities. He doesn't understand what his job is in this critical moment. And all we're asking him to do is to recognize what the job is and then actually do it.